Okay, the immune system meds that we're going to talk about, and again, on each of these systems, we're talking about just a few medications or just a few classes. And I really want you to focus on how to learn about meds, which dig in and figure out what's the pharmacologic action of that medication. Antibiotics were a miracle when they were invented, and now we're seeing some effects of too many antibiotics used in different ways, but we really can't completely comprehend how big of a deal antibiotics were when they were invented or discovered. A few classes that we want to talk about: aminoglycosides like gentamicin. They tend to be ototoxic and nephrotoxic, so they tend to be used for more severe infections and have to be monitored pretty carefully. Vancomycin is similar to the aminoglycosides, but it is in its own class. With vancomycin, we need to monitor for red man syndrome, we need to look at renal function, and we need to be assessing peaks and troughs of these and the aminoglycosides to make sure that we're within the therapeutic window. The antimycobacterials, these are TB drugs. So isoniazid, rifampin, ethambutol, they all can have really serious side effects. Plus, TB is such a slow-growing bacterium that it takes a long-term therapy to treat it. So one of the biggest problems with TB therapy is people not taking their meds consistently for long enough to eradicate it. So now we have TB that's resistant to some of these meds. So one of the things we really focus on as nurses is for TB patients is how to promote compliance with those meds. Penicillins. Penicillin was the first antibiotic discovered. They are broad spectrum antibiotics. Big thing with penicillins is to be aware of allergies. If people are allergic to penicillin, they can have an anaphylactic response. Now, a lot of people have been misidentified as allergic to penicillin. And for quite a few bugs, penicillin is still the best, the most effective option. And so for some people who've been identified with penicillin allergy, a provider, after really careful interview and figuring out what the reaction was, may administer penicillin under controlled circumstances where they can respond to anaphylaxis if it should occur. Cephalosporins. Cephalosporins have also been around for a really long time. We now have first through fifth generation cephalosporins. They all have slightly different characteristics, but they are also broad spectrum antibiotics. One of the most common side effects you'll see with cephalosporins is diarrhea. With all antibiotics, we have the potential for killing off normal intestinal flora and normal vaginal and skin flora, and allowing the overgrowth of bacteria that can be and yeast that can be problematic. So antibiotics are implicated in yeast infections, and antibiotics are implicated in diarrhea and in C. diff. So we need to be aware of that in managing those symptoms. So we talk, antibiotics usually refers to antibacterial medications. Antifungals are specifically developed to kill or disable fungi. And so one of the most common is fluconazole. It's given orally, topically, and it's used for a really wide range of fungal infections. Antivirals, like acyclovir, and there are some more targeted antivirals for flu. There's actually a new one for COVID. Acyclovir is most often used for, or it's targeted toward herpes viruses. I've said too many words today, I'm losing all of them. A lot of antivirals have some pretty strong side effects as well. Like with antibiotics, we want to teach people to take the full course of those medications. HIV drugs are drugs aimed at the particular type of virus that caught the HIV virus. That's a retrovirus. There have been more resistant strains developed. And most patients are taking a cocktail of different drugs to try to keep that virus contained. HIV has become a chronic illness. There have been a very few cases of eradication, but most patients, I would say, you can consider if someone has had HIV that they will always have it. If it can be suppressed enough to prevent transmission, as long as they're taking meds consistently and monitoring for viral load. There are also medications that we give for autoimmune disorders. So these are going to be things that suppress the immune system. Most common is probably glucocorticoids like prednisone. They also have many other effects. They affect metabolism, they affect fluid balance, they affect electrolytes. And chronic use of glucocorticoids has some really serious long-term effects. Gold salts are actually used to treat rheumatoid arthritis. There are a lot of classes of other immunosuppressant drugs. A lot of them pretty specific to, or more specific to certain disease processes. And then there are biologics that are very specifically targeted. Okay, next section will be endocrine drugs.